Hello all. Today we are going to see about Ehlers-Danlos syndrome. I am Mrs. Golden, working as tutor in Tripoli College of Nursing. Objectives: at the end of the class, we will be able to see introduction, definition to Ehlers-Danlos syndrome, causes of Ehlers-Danlos syndrome, that is EDS, diagnostic measures, signs and symptoms, and treatment for EDS. Introduction. Ehlers-Danlos syndrome (EDS) is a group of 13 genetic connective tissue disorders which can be noticed at birth or in early childhood. EDS, that is Ehlers-Danlos syndrome, can occur due to mutation in one or more particular genes. So there are total 19 genes which can contribute to the condition. The specific gene affected which will determine the type of EDS. The genetic causes of this hypermobile Ehlers-Danlos syndrome is still unknown and the treatment is not yet known, but it is supported in nature. Physical therapy and bracing can help in strengthening the muscles and support the joints. Definition: Ehlers-Danlos syndrome is a group of inherited disorders which affects your connective tissues, primarily your skin, joints and blood vessels. Connective tissue is a complex mixture of proteins and other substances which will provide strength and elasticity to your underlying structures in your body. So they are made up of two proteins, that is the collagen and elastin. So in Ehlers-Danlos syndrome, it affects your body's ability to produce collagen the way it should be. So people with EDS may have a weaker collagen. This means that the connective tissue isn't strong and supportive as it should be. Causes: genetic mutation which causes the Ehlers-Danlos syndrome. So genetic mutations are changes to your DNA sequence which happens during your cell division when your cells make copies of themselves. If the part of your DNA sequence is in a wrong place, that means it isn't complete or damaged, but it might experience symptoms of a genetic condition. So even though when we know it is caused by a genetic mutation, healthcare providers cannot identify the exact mutation that causes the Ehlers-Danlos syndrome. So experts have identified that more than 20 different genetic mutations are causing Ehlers-Danlos syndrome. So they will affect your body's ability to produce the collagen. Which specific mutation you have determines the part or the type of the Ehlers-Danlos syndrome and the part of your body which is affected. Diagnostic measures. So coming on to the diagnostic measures can be made by the evaluation of a medical history or any clinical observation. A criteria called as Bayesian criteria. It is widely used to assess the degree of your joints in hypermobility and physical examination by discussing your medical history may rule out Ehlers-Danlos syndrome. They might examine your skin and joints and may ask you about your symptoms. DNA and biochemical studies can also help identifying the affected people. And diagnostic tests like collagen gene variant testing, collagen typing via skin biopsy, and echocardiogram are also some of the diagnostic measures for this EDS. So coming on to the signs and symptoms, so it can affect any connective tissues in your body. So depending upon what is affected, your signs and symptoms may come. That is, if it is cartilages or bones or blood, the signs and symptoms vary dependently. Next one, if it can also affect your connective tissues, but it might experience symptoms in your skin, joints and blood vessels. So these are some of the pictorial representations for signs and symptoms of Ehlers-Danlos syndrome. So these are some of the pictorial representations for Ehlers-Danlos syndrome. So in first picture we can see the picture of hypermobile thumb, and second one is the hypermobile fingers, and third picture represents the hypermobile metacarpopharyngeal joints, and fourth one is the kyphoscoliosis. So these are the pictorial representations of the signs and symptoms of EDS. Okay, so coming on to signs and symptoms, there are different types of Ehlers-Danlos syndrome, but the most common signs and symptoms are overly flexible joints, stretchy skin and fragile skin. So when we are going to see about overly flexible joints, it is the connective tissue which holds the joints together is looser. So what happens is the joints, when it moves far past the normal range of motion, joint pain and dislocations are common in this type. Next one is stretchy skin. Under stretchy skin, weakened connective tissue will allow your skin to stretch more than the usual. So what happens is you will be able to pull a pinch of skin away from your flesh, but it will snap right back into the place when you let it go. So your skin might also feel exceptionally soft and velvety. So next one is fragile skin. In fragile skin, the damaged skin doesn't heal well. So for example, the stitches which is used to close a wound often will tear out and leave a gaping scab. So these scabs may look thin and crinkly. So types of EDS. So there are 13 types of Ehlers-Danlos syndrome, but the most which are rare are hypermobile Ehlers-Danlos syndrome. It is the most common type. And the other types of EDS include classical EDS, vascular EDS and kyphoscoliotic EDS. So these types of EDS are most common. But in this Ehlers-Danlos syndrome, according to the genetic variation, the types of Ehlers-Danlos syndrome also vary. So people with hypermobile Ehlers-Danlos syndrome will have symptoms like joint hypermobility, loose, unstable joints which will dislocate easily, joint pain and clicking joints, extreme tiredness that is fatigue, skin that is bruising easily, digestive problems like heartburn and constipation, dizziness with increased heart rate when standing up, problems with internal organs such as mitral valve problems or organ prolapse, and urinary incontinence are the common symptoms which are found in hypermobile Ehlers-Danlos syndrome. So coming to classical Ehlers-Danlos syndrome. So in classical Ehlers-Danlos syndrome, the symptoms are less common than the hypermobile EDS, which tends to affect the skin more. People with classical Ehlers-Danlos syndrome may have joint hypermobility, loose and unstable joints which will dislocate easily, stretchy skin, fragile skin that splits easily, especially over the forehead, knees, chins and elbows, smooth velvety skin that bruises easily, wounds that slowly heal and leave a wide scar. Hernias and organ prolapse are common in classical EDS. Coming to vascular Ehlers-Danlos syndrome. In vascular Ehlers-Danlos syndrome, it is a rare type of Ehlers-Danlos syndrome which is often considered to be the most serious one, because this vascular Ehlers-Danlos syndrome, it affects the blood vessels and the internal organs, which leads to split open and leads to a life-threatening bleeding. So people with vascular Ehlers-Danlos syndrome may have skin that bruises very easily, a thin skin with visible small blood vessels, particularly on the upper chest and legs. So fragile blood vessels can bulge or tear, resulting in serious internal bleeding. So next one is the kyphoscoliotic Ehlers-Danlos syndrome. So this kyphoscoliotic Ehlers-Danlos syndrome is a rare condition. People with this kyphoscoliotic Ehlers-Danlos syndrome will have curvature in the spine which starts from the early childhood and it gets worse in the teenage years, and joint hypermobility, loose unstable joints, weak muscle tone from the childhood, that is the hypertonia, so which causes the delay in sitting and walking or difficulty in walking, fragile eyes that get easily damaged, soft velvety skin which is scratchy, bruises easily and have a scare on it. So these are the common symptoms of kyphoscoliotic Ehlers-Danlos syndrome. Next one is hypermobility spectrum disorder, HSD. So hypermobility spectrum disorder have people which have problems like hypermobility but do not have any specific Ehlers-Danlos syndrome conditions, but they may be diagnosed with hypermobility spectrum disorder, which is treated in same way as the Ehlers-Danlos syndrome. So treatment for Ehlers-Danlos syndrome. So there is no cure for Ehlers-Danlos syndrome. but it is known and the treatment is only supportive. Close monitoring of the cardiovascular system, physiotherapy can be provided, occupational therapy and orthopedic instruments like wheelchairs, bracing and casting can be helpful. So these can help to stabilize the joints and prevent injury. Aquatic therapy, which promotes the muscular development and coordination, and manual therapy, that is the joint is gently mobilized within the range of motion and or manipulations. So conservative therapy, which is not helpful, surgical joint repair can be necessary. Medications can be provided to decrease the pain and manage the cardiac, digestive and other related conditions which can be prescribed. Other treatment options are pain management, medications like NSAIDs, non-steroidal anti-inflammatory drugs, which helps to reduce the pain and reduce the inflammation. Dislocation and subluxation management, surgery can be done. Prognosis. Outcome for individuals with Ehlers-Danlos syndrome depends on the specific type of Ehlers-Danlos syndrome they have. Symptoms vary upon the severity. Even in the same disorder, the frequency of complications also varies. So some people have negligible symptoms, but while others will have severely restricted symptoms in daily life. So in case of extreme joint instability, dislocations may result from simple tasks like rolling over in bed or turning a doorknob. So secondary conditions like autonomic dysfunction or cardiovascular problems occurs in any type and affect the prognosis and quality of life. Thank you all.